This is JAPI, and welcome to JAPI Podcasts.
In partnership with Torrent Pharma, by the makers of Nebicard and Telsar Biso, where science meets care.
I am Dr. Sangram Biradar. Welcome to the JAPI podcast of the June 2026, JAPI Volume 74, Issue 6. This issue of JAPI has some really interesting articles, including 12 original articles, 3 review articles, 1 point of view, and 1 pictorial CMEs, and 3 letters of correspondence. Let us discuss these in detail. The first original article is titled Hypothyroidism in Non-Alcoholic Fatty Liver Disease by Shyam Chand Chowdhury et al. This cross-sectional observational study evaluated the prevalence and pattern of hypothyroidism in 158 adult patients with non-alcoholic fatty liver disease at a tertiary care hospital in northern India. Hepatitis steatosis and fibrosis were assessed using ultrasonography, fibroscan, and the FIB-4 index, while thyroid function was measured through serum TSH, FT3, and FT4 levels. Hypothyroidism was present in 41.14% of NAFLD patients. Its prevalence increased with disease severity, reaching 71.43% in fibrotic NASH and 44.4% in cirrhosis. A dose-response relationship was observed between steatosis grade and hypothyroidism, with 80% prevalence in grade 3 steatosis. FT4 showed a significant positive correlation with liver stiffness. Additional correlations linked liver stiffness with urea, INR, serum protein, fasting glucose, and LDL levels. The findings suggest that hypothyroidism is an important cofactor in NAFLD development and fibrosis progression. Routine thyroid screening in NAFLD patients is recommended as early diagnosis and treatment of hypothyroidism may help slow or reverse disease progression. The next study is on role of expanded A-drop score in predicting 14-day mortality in patients with community-acquired pneumonia, a prospective observational study. From a tertiary care center in northern India, Reshma Prakash et al. This prospective observation study, March 24 to 25, evaluated the utility of their expanded A-drop score in 80 adults hospitalized with community-acquired pneumonia. Scores were calculated within 24 hours of admission and correlated with ICU admissions, mortality, and length of hospital stay. Overall, 22% died within 40 days of discharge. Mortality increased significantly with higher scores 4.3, 9.1 score, and 54.3 score, where p-value for less than 0.01. ICU admission rates also rose markedly across severity of groups 4.3%, 36.4%, and 71.4% respectively, p-value less than 0.001. Mean hospital stay increased from 4 to 9 days, while increasing scores and showed a significant positive correlation with A-drop severity, p-value of less than 0.00001. The score demonstrated excellent predictive accuracy for mortality. A cutoff of more than 5 point yielded 86.2 sensitivity and 72.4 specificity. Expanded A-drop demonstrated strong predictive power for short-term real mortality, ICU requirement, and hospital stay in community-acquired pneumonias, supporting its value as a simple and effective triage tool, particularly in resource-limited settings. The third original article titled is From Recognition to Reporting, 1-Year Trends in Adverse Drug Reactions at a newly designated Adverse Drug Reaction Monitoring Center, Vasundhara Londe et al. The objective of this study was to analyze spontaneously reported adverse drug reactions during the first year and after the Adverse Drug Reaction Monitoring Center recognition. This retrospective observational study analyzed 255 adverse drug reactions reported at a tertiary care hospital in Pune between April 2023 and March 2024. Elderly patients aged 61 to 80 years accounted for the majority of adverse drug reactions. Anti-cancer drugs were the most common cause of ADRs, followed by antimicrobials. Most ADRs were mild, 78.4%, and non-serious in nature. Recovery occurred with drug withdrawal and supportive treatment in 39% of patients, while 47 were in the process of recovery at the time of reporting. The findings suggest that many ADRs are mild and potentially preventable. Despite recognition of the Adverse Drug Reaction Monitoring Center, underreporting remains a significant challenge. The next original article is on AI. It is titled AI-powered ECG hyperinterpretation system for arrhythmia prediction and hyperkalemia detection using machine learning, Arvind Kumar et al. This prospective observational study assessed the diagnostic accuracy and real-world utility of an AI-powered ECG system for detecting arrhythmias and hyperkalemia in 4,200 patients between March 24 and February 25. Standard 12-lead ECGs were independently interpreted by both a deep learning AI model and board-certified cardiologist. The AI system achieved excellent performance for arrhythmias detection with 97.2% sensitivity and 96.1% specificity. It significantly outperformed manual interpretation for atrial fibrillation, atrial flutter, and ventricular ectopy, p-value less than 0.001. For hyperkalemia detection, sensitivity and specificity were 83.5% and 87.3% respectively. The AI reliability identified all critical potassium elevations within 1 minute of ECG acquisition. The AI generated alerts reduced the median time to therapy by 19 minutes, improving clinical workflow efficacy. These findings support the integration of AI ECG tools into routine clinical practice while highlighting the need for larger multi-center validation studies. The next study is on effect of radiological patterns on response to pulmonary rehabilitation in post-tuberculosis lung sequelae, a prospective observational study by Manudev Mehta et al. This prospective observational study evaluated the effects of a 24-week pulmonary rehabilitation program in 60 patients with post-tuberculosis sequelae. Patients underwent hospital or home-based PR and were assessed for lung function, exercise capacity, nutritional status, quality of life, and psychological well-being. Significant improvements were observed in BMI, 6 minutes walk distance, mean increase more than 150 millis, and DAS-21 psychological health scores across all radiological subtypes. Lung functions, particularly FE1 percentage, improved significantly with the greatest gain seen in patients with fibrosis and bronchiectasis. Patients with combined fibrocavitary and bronchiectasis diseases showed the least improvement but still derived meaningful benefit. Quality of life scores improved in all groups, although differences between radiological subtypes were not statistically significant. Overall, pulmonary rehabilitation significantly enhanced functional capacity, respiratory health, nutrition, and psychological outcomes, supporting its routine incorporation into post-TB care programs. The changing gears to the GI tract, the next original paper is on the prevalence of celiac disease in inflammatory bowel disease, a prospective cohort study from northern India, Munish Kumar et al. This prospective study evaluated the prevalence of biopsy-confirmed celiac disease in 47 Indian patients with inflammatory bowel disease (IBD). All patients underwent anti-TTG antibody screening with seropositive individuals undergoing duodenal biopsy for confirmation. Biopsy-confirmed CED was identified in 11 patients, yielding a prevalence of 2.31% in ulcerative colitis and 3.57% in Crohn's disease. The prevalence of was approximately twice that reported in the general Indian population, although the difference was not statistically significant. Anti-TTG testing showed a high false positive rate of 21.4%, highlighting limitations of serology alone. So, no significant clinical or laboratory differences were found between CED positive and CED negative IBD patients. Ulcerative colitis patients with CED showed a non-significant trend toward more extensive disease colitis. The study supports a selective CED screening in IBD patients and emphasizes the importance of histological confirmation due to frequent false positive serology. The next article is a study of the clinical profile of acute poisoning in adults in a rural tertiary healthcare setup by Minuj S. Murthy and et al. This retrospective study analyzed 100 cases of acute poisoning admitted to a tertiary hospital in rural Bangalore over 1 year. The mean patient age was 28 years, with most cases occurring in the 21 to 30 year of age group and a female predominance 57%. Suicidal poisoning accounted for 85% of cases, highlighting the significant role of mental health issues. Organophosphorus compounds were the most common poisoning agents, followed by drug overdose and pyrethroid compounds. All exposure occurred through oral ingestion, and 74% of patients presented within 4 hours of poisoning. Vomiting was the most frequent symptom, while elevated liver enzymes and erected abnormalities were common laboratory findings. The average hospital stay was 4 days, and no deaths were reported during the study period. Early presentation and timely treatment resulted in favorable outcomes, emphasizing the need for improved mental health support and stricter control of toxic substances. The next two papers are related to nephrology. The first is titled A Comparative Study of Depression and Insomnia Among Patients on Continuous Ambulatory Peritoneal Dialysis versus Hemodialysis by Jai Inder Singh et al. This multi-center cross-sectional study evaluated depression and insomnia in 188 patients with end-stage kidney disease undergoing hemodialysis or peritoneal dialysis. Depression was common, affecting 48.6% of hemodialysis patients and 44.6% of peritoneal dialysis patients, with most cases being mild. Insomnia prevalence was also high and comparable between hemodialysis 24.7 and peritoneal dialysis 22.6% patients. Dialysis morbidity did not significantly influence the prevalence of severity or depression or insomnia. Severe depressive symptoms were associated with lower hemoglobin and albumin levels, indicating a link between poor nutritional status and mental health. The study highlights that depression and insomnia are frequent but often under-recognized problems in dialysis patients, warranting routine screening and management. The next study related to nephrology is titled Burden Trends and Future Projections of Acute Glomerulonephritis in India till 2040, analysis from the Golden Global Burden of Disease Study, Harry S. Meshram et al. The Using Global Burden of Disease 2023 data, the study evaluated trends in glomerulonephritis burden in India from 1990 to 2023 and projected outcomes to 2040. A standardized mortality rates declined by 75%, while incidence remained largely unchanged over the study period. Disability adjusted life years days decreased by 77%, primarily due to reduction in the premature mortality. Males consistently experience a 1.4-fold higher burden of glomerulonephritis than females. Significant regional disparities were observed, with eastern states such as Jharkhand, Chhattisgarh, and Bihar showing 2 to 4 times higher mortality rates than the national average. By 2040, mortality rates are projected to decline further by 52%, reflecting continued improvements in care. However, absolute glomerulonephritis cases are expected to rise by 18% due to a population growth, increasing demand on renal services. The findings highlight the need of stronger primary prevention, early detection programs, and prioritization of glomerulonephritis within national kidney health strategies. The next study is on imiglamin in Indian adults with type 2 diabetes, a prospective multicenter real-world cohort study of prescription patterns, glycemic change, and safety by Bharat Samu et al. This prospective multicenter real-world study evaluated the effectiveness and safety of imiglamin in 736 Indian adults with inadequately controlled type 2 diabetes. Imiglamin was mainly used as an add-on therapy, often in combination with 3 or more glucose-lowering agents. Mean baseline HbA1c was 9.8%, and treatment resulted in significant HbA1c reductions of 1.28% at 3 months and 2.27% at 6 months, p-value of less than 0.01. The greater glycemic improvement was observed in patients with higher baseline HbA1c levels. Fasting and postprandial glucose levels also improved substantially over the 6 months follow-up period. Adverse events occurred in 9.9% of patients, most commonly mild gastrointestinal symptoms, 5.2%. Hypoglycemia was uncommon, 1.2%, and 2 reported cases of lactic acidosis were not clearly attributable to imiglamin. Overall, imiglamin demonstrated meaningful glycemic benefits with a favorable safety profile, supporting its use as an effective treatment option for type 2 diabetes in routine clinical practice. The next original article is on diagnostic accuracy of spot urine uric acid to creatinine ratio in identifying renal uric acid excretion patterns in hyperuricemic patients, a cross-sectional study, Akshata Malagowda Patil et al. This cross-sectional study evaluated the utility of the spot urine uric acid to creatinine ratio as an alternative to 24-hour urine collection in 39 patients with hyperuricemia. The aim was to distinguish low uric acid secretors from normal secretors, which is important for selecting appropriate urate lowering therapy. The spot UAA-CR ratio showed a moderate but significant correlation with 24 hours urinary uric acid excretion. A spot UAA-CR ratio cutoff of 1.59 identified normal uric acid excretors with high specificity 93.1% but moderate sensitivity of 50%. Overall, the spot urinary uric acid creatinine ratio represents a simple, non-invasive, and practical alternative to cumbersome 24-hour urine testing in routine clinical practice. The last original article in this issue is on Semaglutide in practice, insights from a retrospective case series at a Jharkhand Tertiary Care Hospital by Ajay Kumar Jha and et al. This retrospective real-world study evaluated the effectiveness and safety of semaglutide in 60 Indian patients with type 2 diabetes mellitus over 6 months. Semaglutide significantly improved glycemic control, reducing mean HbA1c from 9.21% to 7.3%, p-value of less than 0.001. Patients also experienced a significant weight loss with a mean reduction of 2.6 kg. LDL cholesterol levels decreased significantly from 90 to 78. Renal parameters and diabetic complications showed numerical improvement while thyroid function remained stable. Overall, semaglutide was well tolerated and provided meaningful improvements in glycemic control, weight and lipid profile, supporting its use in routine clinical practice for type 2 diabetes mellitus. The next three articles are review articles. The first one is titled Clinical Practice Recommendations Snakebite Envenomation Associated Acute Kidney Injury by Saurabh Sharma et al. This expert review provides evidence-based recommendations for the diagnosis and management of snakebite associated acute kidney injury, a major cause of morbidity and mortality in India. The guidance integrates recommendations from the Government of India, the World Health Organization, and the KDIGO AKI guidelines. Early recognition of innovation and prompt administration of polyvalent anti-snake venom are emphasized as key interventions. Regular monitoring of coagulation status, renal functions, along with timely initiation of kidney replacement therapy when indicated is recommended. Supportive management of venom-induced consumption coagulopathy, rhabdomyolysis, and thrombotic microangiopathy is crucial. Special recommendations are provided for children, pregnant women, patients with pre-existing kidney disease, and bites from non-big four snake species. Although SAKI is largely preventable and treatable with timely care, survivors remain at increased risk of chronic kidney disease. The recommendations aim to standardize care across medical specialties and improve survival and long-term renal outcomes in India. The next review is on treatment of tuberculosis in renal insufficiency by Nikhil Gupta and et al. Tuberculosis in patients with renal insufficiency presents unique challenges due to altered drug pharmacokinetics, immunosuppression, and a higher risk of treatment-related toxicity. Effective management requires an individualized and multidisciplinary approach tailored to the degree of renal dysfunction. Careful selection of anti-TB drugs and appropriate dose adjustments are essential to ensure efficacy while minimizing adverse side effects. Regular monitoring for drug toxicity, treatment response, and comorbid conditions is critical throughout therapy. Adherence to evidence-based guidelines can optimize clinical outcomes and improve the safety of TB treatment in patients with renal impairment. The other article, Antiretroviral Therapy in India 2025, Drugs Indications and Contraindications, Mechanisms and Prophylaxis by Rajesh Deshwal et al. This review summarizes current HIV treatment and prevention strategies in India, highlighting the advances in ART, viral load monitoring, and prevention programs. The preferred first-line ART regime is the fixed-dose combination of tenofovir, lamivudine, and dolutegravir, with alternatives tailored to specific clinical situations. India continues to follow the treat-all approach with routine viral load monitoring as a key component of care. For post-exposure prophylaxis, a 28-day triple drug regime initiated within 72 hours of exposure is recommended, with increasing adoption of dolutegravir-based regimes. Pre-exposure prophylaxis using tenofovir, emtricitabine has regularly approved, although implementation remains uneven across the country. New prevention strategies, including long-acting injectable lenacapavir, have emerged globally and may influence future HIV prevention programs in India. Persistent challenges include gaps in differentiated service delivery, drug resistance, surveillance, and broader PrEP uptake. Future priorities include expanding PrEP access, standardizing dolutegravir-based PEP, strengthening resistance monitoring, and integrating long-acting prevention options as they become available. Thank you for listening to JAPI Podcast.